Welcome to the second module of the Disability Inclusive Health Services Toolkit. In this first video, we will be discussing what we mean by attitudinal barriers and how they can impact on access to healthcare for people with disability. We will also look at some common attitudinal barriers faced by people with disability. Attitudinal barriers toward people with disability generally result from negative beliefs, perceptions, or assumptions. These are often caused by a lack of knowledge and awareness of disability, the rights of people with disability, or of how to be inclusive of people with disability. Negative attitudes about disability often leads to discrimination and poor treatment of people with disability. This discrimination, in turn, can limit the opportunities of people with disability, including the opportunity to access healthcare. In this way, negative beliefs and attitudes create barriers to healthcare for people with disability. In healthcare, discrimination may occur through the behaviours of individual health workers or through policies or practices that do not promote inclusion or prevent people with disability from accessing health services on an equal basis with others. In addition, attitudinal barriers can compound other types of barriers. For example, the misconception that people with disability do not need access to all of the same health services as other people can lead to health facilities being designed or built without accessibility considerations. So what is the impact of attitudinal barriers in healthcare for people with disability? People with disability commonly report that health service providers have little, inaccurate, or no knowledge and awareness about disability and the health rights of people with disability. This lack of knowledge and awareness results in poor skills and practices by health workers. People with disability also commonly report experiencing discrimination and being denied care, of receiving poor treatment when accessing health services, and that many health service policies and practices are not inclusive of their needs. Attitudinal barriers to health services for people with disability occur across low, middle, and high income countries and when accessing all types of care. There are numerous examples of negative attitudes that can present barriers to healthcare for people with disability. In the next two slides and in the next activity in your workbook, we will outline just a few of them. The first is stereotyping. Stereotyping involves making assumptions about someone based on them having a disability. An example in the healthcare context may be making the assumption that women and girls with disability are not sexually active and therefore do not need sexual and reproductive health services. A further negative attitude is pity. Pity involves feeling sorry for people with disability, which often leads to patronising behaviour. This could include trying to be too helpful for someone and providing assistance they don't require or want, or treating them in a childlike fashion, even though they are an adult. This can be embarrassing and demeaning for the person in question and impact whether they seek healthcare again in the future. Next is fear and avoidance. This includes them being afraid of saying or doing the wrong thing, so avoiding people with disability. In healthcare, this could result in health workers avoiding providing treatment for a person with disability out of fear of not knowing how to interact with them or how to treat them. Another common negative attitude experienced by people with disability is inferiority. In this context, inferiority is the belief that people with disability are somehow inferior or not as worthy of receiving health services. This may lead to other patients being prioritised over patients with disability and as such depriving them of their opportunity for equal access to healthcare. And finally, there is denial. This involves failing to recognise the impact of disabling conditions, particularly those that are not visible, such as intellectual disability, and therefore denying the person reasonable accommodations or adaptations that are needed by that person. In the healthcare context, this could be the refusal to provide a longer appointment time for someone with disability who needs longer to process information and ask questions. The result may be that the person with disability does not accurately follow instructions about taking medication, for example, which can have implications for their health. These are just a few examples of negative attitudes and how they can impact people with disability. There are further examples in the toolkit manual on page 23. Negative attitudes can have a significant impact on our behaviours and practices as health workers. They can lead to health workers providing a poorer quality of care or even refusing care to people with disability. They can lead to making assumptions about why someone is attending a health facility and assuming that it is for something to do with their disability rather than taking time to listen to their needs. Negative attitudes can make health workers unwilling to consider adapting their practices to accommodate the needs of a person with disability, or even considering a person with disability as low priority for health services. Often, these behaviours occur unconsciously, without people even thinking about them, which is why it is so important that we work towards replacing negative attitudes with disability-inclusive attitudes. By changing attitudes, we will change practices, and this will enable health services to be disability inclusive. Let us consider how those health worker attitudes and behaviours ultimately impact the experience of healthcare from the point of view of people with disability. For people with disability, the impact of negative attitudes is enormous and places significant barriers in their way to realising their right to healthcare. Negative attitudes can result in people with disability receiving poor quality care or no care at all. They can experience care that isn't appropriate to their needs, makes them feel embarrassed, humiliated, or increases feelings of vulnerability. They can experience not having their needs listened to or being denied the opportunity to make choices and decisions about their own care. But it is important to remember that the experience is different for different people with disability, and that attitudes may be compounded by attitudes to age, gender, or type of impairment. Women and people with psychosocial disability often experience greater barriers, for example. Ultimately, the end result of negative attitudes is poorer health outcomes for people with disability. If we are really serious about providing universal health coverage and healthy lives for all, then addressing negative attitudes to disability and the barriers to healthcare that arise from them is vital. Now that you have a good understanding of how negative attitudes to disability can create barriers to health for people with disability, please complete the activity in step 3 of the workbook.